As COVID numbers drop and restrictions loosen up, most people are just ready to put the virus in the past. But for some, it's not that easy. Doctors say somewhere around 30% of people who've tested positive for COVID can in fact develop long-haul COVID. That's when someone has persistent and debilitating symptoms that continue weeks to months after an infection. WCNC Charlotte's Chloe Leschner live at Atrium Health in Dilworth. So Chloe, are there any factors that put someone more at risk for developing this long COVID?
Hey, Carolyn, doctors say it's not so cut and dry, but research shows you're not necessarily in the clear if you're young and healthy or had a mild case of COVID. It may feel like the pandemic has been dragging on, but in reality, COVID is fairly new. Everyday doctors are learning more about the virus and its lasting impacts.
It is a burden on patients, and it's a problem that they're trying to deal with.
Long COVID or ongoing health problems 4 or more weeks after an infection is keeping many from returning to normal.
And it's like, okay, well, today you're having a hard time breathing. Today you can't think of words. Today your hip is hurting so bad that you don't want to get up.
Who is more likely to become a long hauler is still up in the air. The Omicron variant infected a record-breaking number of people. Most had a mild case, but research shows there is still a risk some develop lingering symptoms.
So even though people have milder symptoms, it doesn't mean that they won't develop long COVID symptoms in the future. Again, I think we're all hopeful that as milder variants come through, we won't see as much of this and it won't be as debilitating, but it's just something we don't know yet.
Dr. Coral Giovacchini with Duke Health says the number of symptoms someone has when they're infected may be a clue to whether or not they'll suffer long term.
If somebody has, say, more than 5 different types of symptoms that they're presenting with their acute COVID infection, that may predispose to ongoing long COVID symptoms. They don't necessarily need to be the same symptoms, but that probably is something that predisposes regardless of the initial severity of your disease.
Doctors say they have seen long COVID in people who are vaccinated, but their symptoms typically are not as severe. By the way, Atrium Health does have a post-COVID recovery program for people who are suffering. Live in Charlotte, Chloe Leschner, WCNC Charlotte.